and welcome to another in the series of Jainpedia videos. This video concentrates on those aspects of Jainism that be of most use to those who are working in medical fields, in social services, or as a carer. It is hard to establish the number of Jains living in modern Britain, but the best estimate is about 30,000. There are Jain communities in all of the main cosmopolitan areas of Britain. Jains share many beliefs and ideas with both Hindus and Buddhists, but there are also significant differences between them. If you are working with or caring for someone who practices Jainism, then it is important to understand these differences. Like Buddhists, Jains do not have to worship or believe in any gods. Jains believe that the ideas and practices of their faith have been established through the teachings and lives of the Tirthankars. These were people, like the Buddha, who had achieved spiritual enlightenment. The last was Mahavir, who lived about 2,500 years ago. Today, many Jains rely on monks and nuns to guide them in their faith. There are Jain monks and nuns in Britain, and some Jains will look to them for guidance in important parts of their lives. Jains also believe in the principle of reincarnation. Like both Hindus and Buddhists, the aim of practicing Jains is to break free from the continual cycle of birth, death, and rebirth. This is achieved through ridding their soul of karma. When someone is dying, they will be visited by family members, other relatives, and members of the local community. There, the dying person will be encouraged to seek forgiveness for any past wrongdoings and to say prayers such as a Namaskar mantra. There is also the principle of Samadhi Maran. If a Jain is dying and he or she feels that they are spiritually ready for death, then they can request for any life support, including food and water, to be withdrawn. This is not seen as a way of hastening death, but rather as a way of ridding themselves of the desire to live life longer. After death, the body is washed and put into new clothes. A lamp is lit in the same room as the body. It is common for people to remain with the body and for prayers and devotional songs to be sung continually. Jains practice cremation as a way of disposing of the body. However, autopsies and the use of organs for transplants or for medical research are permitted. One of the most important ways in which Jains can remove karma from their souls is by following the principle of ahimsa. Ahimsa means non-injury or non-violence. Ahimsa lies at the heart of Jainism and is the key to understanding how Jains live their lives. Jains believe that all living things should be protected as far as possible from injury or harm. For those working with Jains, especially those in the medical professions, this will have some implications as to how they care for Jains. All practicing Jains are vegetarian. Some will avoid dairy products, some will avoid root vegetables, and some are vegan. It is important to establish quickly what their dietary needs are. In principle, any medical intervention, including transplants and transfusions, that prolongs life and relieves suffering is permitted by Jainism. However, some practicing Jains may want to know that the medicines they are taking do not have animal products in them or have even been tested on animals before use. Jain worship mostly consists of daily prayers and meditations. Jains will fast during festivals such as Paryushan and on other holy days. Fasting can easily be suspended if the fast is seen as harmful. This can include pregnant women or those for whom food and water is an essential part of their recovery. If you want to discover more about the Jain faith, then the Jainpedia website has lots of articles and collections of images to help you find out more. If you are working with children or young people, then the Learn Jainism website, which is aimed at children and those who work with them, has games and activities that can help you gain a better understanding of Jainism, as well as provide some education and entertainment for children.